My name is Denis Kibira, and I'm the Inter-Country Coordinator for the Health Systems Advocacy Partnership at Health Action International. And under this partnership, we do an annual study on access to sexual reproductive health commodities. And last year, 2019, we did our third study in the countries of Kenya, Tanzania, Uganda, and Zambia. And what we see across the four countries, generally, availability keeps fluctuating and is not consistent. And for example, on contraceptives, there's still a key challenge in providing the full choice that would enable access to these commodities. There are also similar challenges across the countries when it comes to availability of medicines for preeclampsia, which is hypertension in pregnancy. The medicines that are needed for this, particularly magnesium sulfate, which is used at health center or hospital level, availability for this was really low across all the countries. Also, other medicines like methyl dopa and calcium gluconate, which can be used for these conditions, were quite low. Medicines for children, particularly for pneumonia, which is amoxicillin, the dispersible tablets, were quite low also across countries, but also medicines for diarrhea in children, which is zinc and the oral rehydration salts, require attention. What we also see from the countries is a need to improve supply chains, but also to finance, because the financing available was mentioned to be a major hindrance to having these commodities readily available to the communities. One of the recommendations that has been made is really to have client education to improve the demand side of these commodities, because that has also been a challenge. When the commodities are not demanded, then they are not stocked by the facilities. We hope that the momentum, particularly in Kenya, in the counties of Kakamega, Kisumu, and Narok, that this will help improve advocacy to have these commodities readily available and accessible to the communities, and work particularly on teenage pregnancies, particularly for the counties of Narok and Kakamega, will be very, very important in terms of improving overall maternal health.